The story is down and dirty like so many people in this country. We always carried insurance. I heard you say it. We've always been responsible. We've always worked. We raised 6 children. We have 14 grandchildren. Had our own home. Worked and bought a better home. Moved up in life. Did what we thought we were going to do, and then got sick. But our insurance had been drifting for a long time. The premiums rising and the coverage getting worse at the same time. But if you're not sick, you don't feel that quite as much. You feel the pinch of the premiums, but it's not, you can handle it. But my husband's artery disease and peripheral artery disease was pretty severe, and it took a nick in how much he was able to work, and then I was diagnosed with uterine cancer. And it was very difficult for us to sustain not only the illness and not being able to work all the time. I went back to work too soon after the cancer surgery and developed a huge abdominal hernia, and then had to have that repaired and was out of work for a couple of weeks. But you know why I went back to work? I was scared to death to lose my job or lose my benefits. So it's the same story over and over again. I was just talking with our minister and our history professor out in the lobby. How can any of us listen to this woman's story about that child and not fight to change this? We are the blessed ones from the movie SiCKO. We lost our house and we declared bankruptcy, but we're the blessed ones. I was hired by the California Nurses and National Nurses Organizing Committee in February and moved back to Chicago as my hometown, but Larry is a Colorado boy, so give him a few kudos for trying to fit into urban Chicago.
Yeah, it only took us 2 hours to get here.
I'm telling you the truth, he didn't leave the apartment for 3 weeks. I said, you have to leave. What is your problem? He said, I don't know where I am. I said, and no one in Chicago will tell you how to get there? He said, no. Anyway, we're the blessed ones, but what I do for a living now, not only do I've been, like Nick, I've been all over the country speaking about healthcare. I've been in 30 states in the District of Columbia. The people of this nation are not the problem. We get it. We understand. We know the system needs to be changed. But what I do during the day when I'm in Chicago is I read patient stories that come in. I want you to send yours, please, to me, because we use them in our work to take them to the national level and say, the system is so very broken. And as you can imagine, sometimes I can't ever believe there's more tears to cry, because I listen and I think, oh, I just can't, it's hard to believe we're doing this to each other. We are better people than this. We really are. So thank you very much for holding this hearing, and I'm so glad that Mary Flowers is in our state, leading the charge on this bill. Realistically, it's probably going to take us a little bit more time and a lot more supporting of legislators like Mary Flowers and like John Conyers. And at the national level, we're going to have our Congress put forward H.R. 676, single-payer health care on a national level. We have to make it happen. There's already 91 co-sponsors. That's more than 20% of your House of Representatives. More than 20%. That's a big percentage. Already believe the single-payer plan is the way to go. We do not have to rewrite legislation. No need. It's there. All we have to do is give them enough courage, push them hard enough, tell them we're pissed off enough, and move it forward. And I'll close by telling you a little story. I was in Pittsburgh this week. Some of us from the Progressive Democrats of America had found that we needed to lobby our platform for the Democratic Party, and not everybody here is probably a Democrat. I am, but our party has not always done what it should do with health care, in case you hadn't noticed. And the platform didn't read the way we thought it should read. We thought it should say that we needed single-payer health care. And the platform was really squishy language about covering all Americans and making sure we all had access to affordable coverage. You notice how they talk about universal coverage a lot? Whenever I hear that, I think, no, Larry, I'll tell you, I want to throw things at the television. Because the word is health care. Health care. I don't want more insurance. So anyway, we lobbied them. We got some language in that we didn't get everything we wanted in that platform by any means. It was pretty tough. John Conyers was there with us. We got the language changed from affordable quality health coverage to guaranteed health care for every man, woman, and child in America. But that's just a platform, and people sometimes don't understand. A platform's kind of a philosophical document. It's not legislation. So all that does is give us something to point back to. And so we couldn't get them to use the word single payer, I'll promise you that. And we could not get them, we wanted to say no financial barriers to getting health care. And they looked right at me and said, no way. So we have a long way to go, folks, and it is us. We're going to have to do it. We have to push them. And I agree, the pharmaceuticals are strong, the corporate media is strong, the insurance companies are strong, but we, if we want to be, are a hell of a lot stronger than they are.
I agree.
And I don't know about the rest of you in my generation. I'm in the baby boomer generation. I'm going to be very honest. Though I've been involved and I've been voting, I even ran for the state legislature many years ago. I didn't win, unfortunately, but anyway, done a lot of things. I have been a little bit asleep at the wheel in terms of putting the passion and energy and power my generation said it was going to put into this country. We said it back in the 60s and the early 70s. We said we were going to rock the world. And then we got busy having kids and working jobs and doing all the stuff we did. And I don't think we kept our nose to the grindstone and keeping this country what it should be. So we're back. We're back.